today I'm really excited. I have an amazing guest, Mairead Painter. And Mairead is the state ombudsman for the long-term healthcare living in Connecticut. And I am just so thrilled to have her as my guest. She's going to talk to us about legislative issues, staffing issues, how she got started, why the work is important, and share any little bits and wisdom of knowledge that I can possibly get out of her. So Mairead, welcome. Thank you so much for being here with me today.
Thank you so much for having me. It's a pleasure to be here and to talk about what we do and why we do it.
And you are the ombudsman, and the ombudsman basically is a Latin word, if I'm not mistaken, that acts as the advocate for the patients who are in long-term healthcare facilities. Am I correct?
Yes, so I'm the long-term care ombudsman. We have several different types of ombudsman in Connecticut. So I'm the ombudsman for long-term care for individuals receiving long-term services and supports.
And how do we define long-term? Is it more than 6 months, 12 months?
It's when they're going to need an ongoing service for a period of time. I would say it was long-term. Somebody who is receiving waiver services or supports in the greater community, as well as residential care homes, managed residential communities, so what we would think of as an assisted living, or a traditional nursing home.
Okay, we used to call them nursing homes when I was a kid, but we call them assisted living facilities now?
They're different levels of care. So we have nursing homes, a traditional nursing home, but we also have managed residential communities, which are communities where people can move at any time. And then as they progress in age, in potential needs, there's services there to support them through that progression. And those are mostly private pay, but here in Connecticut, we do have some that are supported through pilots or through other state systems.
Okay. And how many are there across the state of Connecticut?
Nursing homes, there
are... Nursing homes, healthcare facilities, assisted living, a lot.
Yeah, so in Connecticut we have, I think right now we have 196 nursing homes, traditional nursing homes. I would say we have about close to 100 residential care homes, and our managed residential communities or assisted living communities are growing every day. And you have to look at, is that congregate housing? What type of services and housings are part of that, and then you're probably looking at another 100 to 200 of those.
Oh boy! So what do we come up to? About 500?
I would say around 500.
About 500.
If you count everything, yes.
Okay. Yeah. And you are kind of the go-to person if somebody has a question, concern, comment, needs to know something. You are the go-to person. Mairead Painter.
Everyone is welcome to call our office, and what we do is we can provide something called an information and consultation, which is just you call, right? You call and you ask us questions. We are free, confidential, and that component of mandated reporting we are carved out of. We are not mandated reporters.
Oh, nice.
So that people have privacy.
So HIPAA is in place for your agency and the work that you do.
Yes, but normally we would have to be reporting things that people brought to our attention related to abuse and neglect, and we don't. We're carved out of that because we support the person, we represent the individual.
Oh, interesting.
So we are different in that way. So people can call with complaints, they can call with concerns, but they can also just call with questions if they need support, if they want to know, is what the long-term care community telling them correct?
Okay.
And we can say, yes, it is, or maybe you want to ask these questions or offer them support and an opinion.
So you kind of are like a counseling service to some extent, and advice, like a little bit of the lawyer part of it, just knowing what to do, what to ask, how to ask it.
Yes, we are not attorneys, but we do offer that support, and we'll let people know if we feel maybe they should be speaking to an attorney, how to use Plan Connecticut, which is a service that offers support to individuals.
Plan Connecticut?
Plan Connecticut.
P-L-A-N. Connecticut.
Yep.
Okay.
And there's a list of attorneys there, elder law attorneys, individuals who are known to the state. So there's some assurance there. We don't vet anybody, but you know that they're individuals that are part of those services. And that list is available online for people.
Oh, interesting. Okay. And what do we consider elderly at this age and stage anymore? Is that changing, or is that pretty much 55 and over, or what's elderly?
I think it really depends on the person. Okay. And so I actually don't really use the word elderly anymore. We use the term older adult.
Okay.
So we have young adults, we have older adults, because I think everyone looks at that differently.
Okay.
And from our own vantage point, I have had people in their late 80s, early 90s tell me they didn't want to go to the senior center and spend time with all the older adults, which I sometimes think, oh, all right, but that's their perspective.
Well, and they have really good resources there. And I know that Groton just changed the name of their senior center to Thrive 55 or 55 and Thrive. So over 55-year-olds thriving and doing fun things.
Yes, because I think people, as we age, people want to distance themselves from that, when I think we should really be embracing it. Instead of looking at senior centers, I'd like to see community centers where we have intergenerational connection.
Absolutely.
There's so much that we can learn from older adults and support.
And vice versa. So the little ones get so much energy from the older people, and then the older people get so much energy and life from watching and interacting with the little ones too. So
education, they can work on after school programs. There's a lot that individuals can give back and still continue to feel purposeful in their living. We actually have a bill this session about ensuring that individuals, no matter where they live, so in a long-term care setting, have access to the community colleges. And we're hoping that they'll be able to take online courses for lifelong learning.
I love that.
Yeah.
I love that.
I'm really excited about that bill.
Yeah, okay. So, and I want to talk about legislation, and we talked a little bit about any legislation. Is there anything related to staffing going on, or how is that going as far as your work?
There's 2 staffing bills here in Connecticut that are pending, so I would encourage people, if you have an opinion about staffing, to look at those bills and to really refer to them and talk to your local lawmakers about that. And
so that would be Chris Murphy and Senator Blumenthal, Senator Chris Murphy and Senator Richard Blumenthal, correct?
That's at the federal level.
Okay.
So there is a federal staffing bill as well. The federal
Okay.
staffing bill, I'm actually a little concerned that they may roll it back some. There's been a lot of push from the industry to decrease the number of hours that are required and how they're required in the federal bill, but it's so important. I'm not sure that they understand the financial impacts, because if people don't have good care, they end up in the hospital. If they end up in the hospital, that's a Medicare bill. Those are the other dollars that we're spending in a different way than if we had just paid for and ensured that there was appropriate staffing on the front end.
So this would be preemptive. This would be helping them while they're in their residential facility, having a better quality of life with activities and maybe food and quicker response to a question that they might have, or other people to have opportunities to visit with, right? So
having the opportunity for individuals to voice their goals, preferences, and priorities, and then have those goals met in the way that the person prioritizes them. That's when we see the best outcomes for people, that person-centered care, and individuals live the life that they want to live in the setting that they're choosing to live it in.
Nice. And it's all about respecting that person and the individual. And when I'm ever in a healthcare facility or assisted living facility, I'm always amazed by the intelligence of the people and the quality of life that they have pretty much given up to be in that facility. So honoring that and respecting that as much as possible.
Absolutely. And ensuring that we're doing what they want. Sometimes, I'm a family member. Sometimes we have our own opinions about what someone should be doing, how they should be receiving care, what that looks like. But when we step back, the person may have a difference of opinion on how they want to live their days. Maybe they don't want to leave their room. They want to sit and read. We have to look at how did that person live their life prior to being in that setting, and just because there's opportunity to socialize or to do things, that might not be in that person's wheelhouse. So really,
I get that.
Stepping back, we don't know best. Stepping back
don't.
And saying, what do you want? How do you see your best day? I think is the most important.
Oh, I
it's
like
hard.
that. How do you see your best day?
Yep.
That's a great way to frame that question.
Thank
so
you.
before we move on, anything else about legislation? So we know about staffing and barriers to transition, and
one of the barriers we see to transition is accessible housing, right? Affordable, accessible housing for individuals. We know there's pockets of the state where that's more challenging, right? Eastern Connecticut, a lot of the homes are older, so having them be accessible can be really challenging.
Oh, sure.
There's pockets of the state where housing just isn't affordable. It's difficult to find rent that is within the limits and the parameters that's allowed under the rental assistance program. And so that could be really challenging for people who are choosing to receive their long-term services and supports in settings other than a nursing home or a residential care home, assisted living. They want to live in the greater community. Maybe they want to have shared housing with someone. Golden Girls style, we kind of joke about that people can choose to do that. It's about having access to housing.
In transportation, I would think too, and then facilities, so that you have like a grocery store or a drugstore or can access and get what you need, basically, right?
Absolutely, and we've been working with some communities on that, and AARP for livable communities, so that someone can live in their community for as long as they want to. An example of that is the town of Southington's really been working on this and being dementia friendly and ensuring that
They call it dementia friendly?
Yep, dementia
Wow.
friendly, so that
I have never heard that term
restaurants,
before.
storekeepers, businesses know how to respond and support individuals if they are experiencing cognitive changes.
Oh,
And
I love
the,
that.
The town values people no matter what point they are in their life and as they age to support them in living in their town. And
That's
I think
a whole
that's a
nother
beautiful,
conversation.
yeah, it's a beautiful, respectful way of looking at aging and including people in the YMCA. They're doing a lot of work there through LiveWell, which is one of their long-term care communities, and we're seeing this sort of transition throughout the state in other settings and what people want. And so when people want it and they drive for it, that's where hopefully companies will move going forward, as well as the small home model. Not building, there's a potential bill this session related to.
Oh, like tiny homes?
Yes, exactly. There is one related to tiny homes, but opening the bed moratorium. So here in Connecticut, we're not allowing.
What does that mean, bed moratorium?
So nursing homes, if they close beds, you can't open them somewhere else. But what's happened is over time, a lot of our nursing homes have aged, right? And so we do need some new settings, but we want to make sure that I testified, I think last week, that if any homes are opened, that they should be by owners that have a good history of service and quality and providing people with dignity. And those are the owners that we want to see continue to invest in Connecticut and open some of these small homes. We've seen one in Marlborough that's a residential care home that's smaller and new.
How big is that?
I think it's 12 beds, 12 to 17 beds, but it's in a neighborhood. You wouldn't know it was a long-term care setting.
So it's almost like a group home?
I don't think of them as group homes because people are choosing to live there. Their individual needs are respected. They are in group homes as well.
So it's a great big house, like almost like a mini mansion or a mansion that has.
It's a big colonial. It's a
Okay.
big colonial home. That's what we're really looking at. I would love to see lots of these scattered throughout communities in Connecticut so people can stay in their communities of origin. They can stay near their friends, their family. This home in particular, people can take the transit bus to the senior center.
And see, that's the perfect thing.
Yes.
If you can have transportation
Care
available.
services.
Care services.
Care and services, so they have their care needs met. But when you walk in, there's just a regular living room. There's a big kitchen counter where people can sit. They can help make dinner. They can not make dinner. It's really about what they would like to do. When I was there, someone had their
So
dog.
it's kind of the Golden Girls
Yes.
hyperbole, like
Correct.
on steroids, like because the Golden Girls were just 3 or 4 women together. So this would be three times that, right?
Correct. I laugh now because I think the Golden Girls were actually my age when they filmed that show.
Are you serious?
Yes.
That's so funny. Yeah.
You know, when you think back, you think they were so much older. They weren't.
No.
But yes, having the ability to stay in your community of origin and have people from your own community taking care of you, I think is really important. Having access to the language you speak, the food that you enjoy eating, really increases your quality of life and the dignity that you feel when you're being cared for.
And then longevity too? Does that increase your length of life perhaps, or?
I think it could, but we also can respect the fact that some people maybe don't want certain treatments or decide that they, that they are choosing their vision of a holistic best day is without a lot of intervention.
There you go.
And so I think we'll see different choices by different people. We're seeing less of the historic medical model where people now question things differently.
So if you don't call it the medical model, and I worked, my background is as a speech pathologist, so I learned both about the medical model and the educational model. And it wouldn't be the educational model. What would it be? Social model? What?
I call it I would think of it as an integrated model where you're taking the person has the right to take the best of every model
Exactly.
and see it as their model in a person-centered way. They integrate whatever works best for them. So it might be some medical interventions. It might be maybe it's music therapy.
Oh, I love that.
To relax them versus a medication in the afternoon.
Oh, perfect.
Maybe it is spending time outdoors or with young people. And so whatever it is that helps support them, We know that pain can be, you can have pain intervention from medication, right? That can help support.
Or just laughing.
Or laughing, or meditating. For some
Right.
people, meditation
Breathing.
helps. So I think people, as we've grown as a society, have really looked at how can they integrate lots of different types of interventions to best support their individual path forward.
I love that. My brother got treatment. He was basically dying of cancer and was at Sloan Kettering, and I just so respected the work that he, or the therapies that he received there. And they were amenable to just about anything if he thought it would be beneficial to him, and if he said, I want that, they would say, okay, they gave it to him. So before we move on, have we touched on everything legislation? There's so much.
There's so much legislation, which is wonderful. In the past 3 years, we've seen so much.
Our listeners or viewers should look into it to support you and support the work of, I don't even want to say older adults. I'm catching myself on the words now. I'm trying to be informed and saying the right things. So.
Older adults and individuals with disabilities is who we support. And if people really want to know, they can go to our website. We have
and how do we access that?
I would just Google the Long-Term Care Ombudsman Program.
Long-Term Care Ombudsman. Ombudsman is OMBUDSMAN?
Yep.
Okay.
Or CT space LTCOP. It'll pop right up.
Okay.
And we have an advocacy section right on our page, which goes over how to follow the bills, what bills might be important to you, what bills have passed in the past couple of years.
Okay.
So it really helps focus people. And then if you're interested or people want to testify, for me, the one way we really move bills forward is by people telling their stories.
Absolutely.
About how things really have impacted them. When nursing homes closed during the pandemic, we had so many family members, friends reach out that we passed the essential caregivers bill so that no one's left alone again in a long-term care setting.
And that was
only
so hard
happened.
how people passed and
Yes.
couldn't be with their loved ones to have their final breaths together. Right?
Yes, very traumatic. And I think we don't want to ever see that again, but we would not have passed that bill without our statewide family council, without individuals, friends, and family members going and telling their stories about what happened both here in Connecticut and at a federal level.
So you wear a lot of hats.
Yes, yes, and sometimes many hats throughout the day.
Oh, I'm sure. But your background is in social work. You
Yes.
got started in that. And why did you decide that you wanted to be a social worker? How did that all come to be?
I think just as a child, I interacted with social workers. We had foster children, and so there were social workers in our lives, and I thought I wanted to work.
So your mom was a foster
parent?
Wow.
Our parents were foster parents.
Wow.
And we, I think from that, I had a respect for social workers.
The work is so integral and so important, and not necessarily given the monetary for what they do or necessarily the respect, right?
Correct.
But it's so important.
And just like speech pathology we were talking about earlier, there's a lot of different things you can do
Absolutely.
in social work, which I didn't know, and I thought I just wanted to focus on kids. But
Well, they call it micro or macro, right?
Yes.
So you're actually doing both, actually,
At this level, yes.
simultaneously.
yes, so
Okay.
I started off in working in nursing homes as a social worker, which I loved. I think nursing homes are essential. They're an essential support within our system. I think we can grow and change them, but loved working there, loved the team of people that I worked with and the individuals I got to meet. From there, I went on to work with children through the Department of Children and Families and learned so much there. The individuals who work there are incredible people. And
they're doing intervention and
they do in a day what the social workers at DCF do. I can't even describe to people what they give of themselves. It's very difficult work. And from there, I became a regional ombudsman.
Okay.
So I have 8 regional ombudsmen on my team, and they go into all of the settings that we support.
So your 8 regions would be like New London County.
Ours are, we have tough. We have Southern, sort of from almost Bridgeport down. We have someone in the greater New Haven area who covers kind of all the way over here. We have New Haven North, and then just east of New Haven through eastern Connecticut and up towards almost Willimantic, north of Norwich. Then we have someone in upper eastern towards center, and then 2 in center and 1 in western. So we're kind of, it's a different makeup. We go by how many long-term care settings are in those regions.
Okay.
We also have a new program, which is a community ombudsman program for individuals who are living in the greater community and receiving long-term services and supports.
What do you mean greater community? The greater community of anything, any place.
Yep.
Okay.
When you receive home care services
Oh.
or waiver services in the in your own home, that's what that program supports those individuals. And I have one manager, Dan Beam, who's the manager of that program, and one person for the state that covers the services. So we're trying to grow that program. Right now it's just information and consultation if you have a question or concern related to your home care. And sometimes it's not about the service. Sometimes it might be, do I have the right at this point to ask for hospice, or maybe my family's not comfortable. How do I have that conversation?
Okay.
Where can I get support related
Some
to that?
how-tos then, not just what, but yeah.
Yes, and not always just a complaint. Like some people think it's just, I may have a complaint, we may have complaints about a service, but a lot of times it's questions about, can I do this? How does this look? What are supports that I can have? Where in my community can I get supports related to a multitude of things? And so we try to connect people to that.
Well, wheelchairs, walkers, the equipment is always so important, yes.
That too, yep.
Okay. Wow. So you got into social work and then just moved up the ladder and have expanded your skills and your touch and your reach into a lot of different areas.
I did, and went to DSS to work with community options, what options people have in the community here in Connecticut, which we have more options here in Connecticut than in many states.
Really?
Absolutely.
Good to know.
And then looking at right size rebalancing, which people have a question about.
Right size?
Rebalancing.
Rebalancing, okay.
Looking at where the budget is spent. So there's a large portion of the budget that is spent on long-term services and supports, and ensuring that people are getting them and receiving them in the setting that they feel best supports them. So traditionally here in New England, we are very protective people. And so for a long time, people just went to nursing homes. But we started to get a lot of feedback from individuals that that's not how they saw their best day. And they wanted their best day in other ways, and ensuring that just because they had Medicaid didn't mean that they had to only receive those services in a nursing home. And so having the access to waivers and waiver services, I would encourage anyone who needed that level of care before you sell your home, before you spend down, to reach out to the access agency in your area, so an area agency on aging or Connecticut Community Care, and ask for an assessment. And from the assessment, they can tell you with your coverage, your insurance, what you're eligible for, so that you're making a fully informed decision. You're not making a decision based on what one person tells you or the setting you're living in. You're getting a holistic view of what are your needs, and then what are the services that are available to you at this time.
Well, and that's just such important information that we could have, and to pre-plan basically as we age and as our parents age or loved ones age, to know what's available and how we can have them live their best day.
Absolutely. And there's actually access now to a lot of information online. If people go to mycommunityoptions.org, you can put in words and it'll pull up. If you put in the word that you're looking for, maybe it is durable medical equipment or a walker, maybe it's a type of housing or setting that you're looking for. You can put that in and the area you want to look at, and it's fed through 211. The United Way, so all of that information is out there. I think people just don't always know where to find it, and a trusted source.
There you go. And then 211 would be another option for people just to make a phone call to them.
Absolutely.
They would connect with you if they wanted to with that, right?
Yes, so 211 is going to ask them questions and try to get to the root of the issue or concern that they have, and then make those connections for them.
Okay. Wow.
Absolutely.
You're just like a source of information and knowledge, and
Thanks.
this is really helpful, so I really
Great.
appreciate that. So how did you get started with this, Mairead? How did you get started in working as a social worker and doing this kind of work with older people?
I love rights. I loved the idea that you have rights, and none of those rights change just because the setting you live in changes. And I just thought there was something so interesting and unique about that wasn't always known. I think people hear, oh, well, the doctor ordered that.
Oh, interesting.
And yes, doctors, APRNs, physician's assistants, they give their best medical professional advice.
But that might not be appropriate for me.
I may choose, because I live in my own home,
Right.
my physician or my medical provider might give me their advice, and I choose to accept that advice or not.
I like that.
I tend to accept it because I believe in my trusted medical providers.
Of course.
But there may be things where I say, oh, you know what, I don't think that's going to work for me. Can we try something else? And we have that dialogue. I think in long-term care, for a long time, people said, well, the doctor ordered it. And yes, the doctors do give orders, but I joke that no one in nursing homes joined the service. We don't take orders. We take your best medical professional advice, and then we decide, does it work for us, right? Does that work for me? And ensuring that they have the ability to have those conversations with their medical providers. Why are they worried about something? Why don't they want a certain medication? And can that provider work with them to ensure that their needs are met and that they understand why the medical professional is making that decision or recommendation. Yes.
Right.
But you don't lose your rights because of that setting. You can still say no, thank you. And I think as just like society has changed, people have started to question things, right? People have different ideas about, again, that integrated medication or integrated way that we see our healthcare. And so we're seeing that play out even in our long-term care settings, and that's what people want. And that intrigued me, that we could really help be the champion for people's voices being heard. And ensure that everyone's voice is heard, even for people who maybe aren't able to verbally communicate.
Oh, yeah.
Right, that we can look at how they're responding. Are they wincing? Are they turning away? What are they telling us? How maybe did they live their life? Can we talk with their representative to say, you know, why do you think this is happening? What might they want? And really try to honor that person. And the biggest gift you can give your family, your friends, is to have those conversations early on about what you want and document that so that people aren't trying to guess. And if
nobody knows but the person who is in that situation, right?
Exactly. And if you couldn't communicate, or let's say someone is towards the end of their life, right, that you have that time to be able to spend and enjoy that person and to be with them without them having to make all those decisions at that time is a true gift.
Wow. Those are little pearls of wisdom. Thank you so much. That's really impressive. Thank you so much. And you know, my husband is a patient advocate, and that's been such a wonderful, life-giving experience for him to go in, and he goes to Beechwood and just loves the residents there, was able to meet with a 105-year-old, I think, recently, and there's just so many. These people are just still bright and able to communicate, and they have all their ideas and opinions, and they perk up when they see him. What kind of work can we do as just regular community citizens? Can we volunteer? Can we offer support to our local residential facilities?
Absolutely. So volunteerism is incredibly important, and unfortunately we have seen a decrease in volunteerism. We really want to see an increase in that. So people can just volunteer at their local nursing home or other long-term care setting, but they can also volunteer for our program, which your husband does do, and be a resident advocate. And so, but that has to be certified. So there's a certification program, there's training, there's education, and they have the support of the regional ombudsman as well as me. And they go in and they work with the residents on a weekly basis to help address concerns, but also to bring up ways that they can see their community improve, right? If it's their home, how are they working with the administration to ensure that their voices are heard? We also have a statewide family council and a statewide resident council, an executive board of presidents of resident council, and they're incredible. The work that they do, they support my office. I talk to them about the legislation that I'm moving forward to ensure that it really, do with, not for. I want to make sure that I'm representing the voice of the people I'm supposed to be serving. They're not just our ideas or what we think will work. That's a major component of our program. And so they work directly with our volunteers to ensure that everyone is understanding sort of where healthcare is at, how to best support people and encourage that high quality of life.
Oh, that's lovely. That's really wonderful. Wow. Important work. So thank you so much for all of that you're doing. What words of wisdom would you like to share to maybe the next generation, somebody who would be interested in following in your footsteps, working with nursing homes?
I would really encourage people to see people of all ages and all abilities in a holistic way and allow them to live as their authentic selves in the community that they choose to live in, and not see someone for their differences, but to try to find the alikeness that they have with someone. I've shared a story that we had an older woman who was fairly depressed because she lived in a beautiful community surrounded by people, but was lonely, even though she was surrounded and had a lot of activity. But she expressed that she didn't have any of her people there. She was a ballerina. She didn't have anybody to talk to about ballet. She needed younger people who were learning ballet, and as a prima ballerina, she could coach back. You know, there's ways that we can connect people.
Now, how do we do that?
Digitally. Yeah, like say, okay, again, what is your best day? Her best day was to talk about ballet all day. Of course. So connecting to maybe a school where they didn't have a prima ballerina to help coach would give her purpose again.
Oh my goodness.
We often think of putting people together in maybe all the older adults playing bingo. That's not some love it, but today there's people want to do things differently. And so as a younger person, I would say finding ways to connect, seeing anyone at any age as someone who might have the ability to offer you wisdom, to provide support, and someone that you can support as well.
Wow, wow. Well, thank you so much. This has been a wonderful interview. Is there anything that you want to share before we call a close?
Sure, people can feel free to call my office anytime. Our number is 866-388-1888. Again, they can call with long-term care questions. We don't have all the answers, but related to long-term care services and supports.
And you'll find out.
Yes.
If you don't have the answer, you'll say, I'll find out.
We'll help shepherd them to the source of the information, yes.
Oh, Mairead, thank you so much.
Thank you for
it's been such
having
a pleasure.
me. Have a great day.